Okay, in this video, we're going to talk about some miscellaneous hormones. A biggie is called eicosanoids. Now, eicosanoids, these are we're talking about local hormones that are released by all body cells, but the two biggies are leukotrienes and prostaglandins, and these are involved in inflammation. When I think of leukotrienes, I think of the airways, like the bronchioles. When I think of prostaglandins, I think of smooth muscle contraction. Think of a woman's uterus. A woman can take ibuprofen or aspirin, which are a prostaglandin blocker. And what does that do? It relaxes the smooth muscle contraction during that time of month, so a woman's not experiencing that much discomfort and pain. We know that prostaglandins are involved in platelet function and creating a clot or a thrombus. We also know if you take a prostaglandin blocker like aspirin, you could bleed, right? Because it thins the blood. We know prostaglandins are involved in fever. So if you take a prostaglandin blocker, you can reduce fever, just like with aspirin or ibuprofen. Okay, so ibuprofen and other NSAIDs. NSAID stands for non-steroidal anti-inflammatory drug. That's an NSAID. They treat pain, fever, inflammation by basically inhibiting the prostaglandin synthesis. Now, within a cell membrane, we have something called arachidonic acid. That's within the phospholipid bilayer of the cell. When there's pain, the pain is stimulated by something called bradykinin. Bradykinin is going to stimulate something called phospholipase A. Phospholipase A is going to pull arachidonic acid out of the cell membrane. And now we have these COX enzymes that converts arachidonic acid into prostaglandin. Or we have LOX enzymes that converts arachidonic acid into leukotrienes, two inflammatory pathways. If a person takes aspirin or ibuprofen, it just blocks this pathway here. It does not affect this pathway here. If you take aspirin or ibuprofen, it's going to decrease pain, swelling, and inflammation because they are prostaglandin blockers. Okay, so people take COX inhibitors, and they could be COX-1 or COX-2 inhibitors. A lot of the arthritis medication block these COX pathways, decreasing prostaglandins, decreasing pain and inflammation. If someone's asthmatic, this is inflammation and bronchoconstriction, so these people take LOX inhibitors. If they take a LOX inhibitor, the lipoxygenase inhibitor, then leukotrienes become diminished, and then you get the bronchoconstriction is not really there. So a lot of the inhalers tend to be LOX inhibitors. Okay, so this is an important concept, right? Arachidonic acid is metabolized to produce inflammatory mediators. Many current anti-inflammatory and pain medicines are used to inhibit the arachidonic acid pathway. There are lots of natural things that do this as well that won't hurt the stomach. Okay, boswellia, turmeric, fish oils, things of that nature, and lots of Japanese knotweed. These are things that downregulate the inflammatory pathway.